If they cut more than they're doing right now, I won't be able to treat my patients.
With Santé Quebec now the central agency responsible for managing the operations of Quebec's entire healthcare system, the Federation of Specialized Physicians of Quebec, the FMSQ, are denouncing cuts in the health network, saying there can be serious consequences to an already critical situation. The province's health minister previously said he's looking for Santé Quebec to help reduce ER wait times and surgery delays, but this transition comes with a directive to cut $1.5 billion in spending. The FMSQ says patients will pay the price.
The government says that there won't be any impact on patients, but that's not what we see in the healthcare network. We see a lot of cuts in personnel with impacts on care.
President of the FMSQ, Dr. Vincent Oliva, said they are proposing a moratorium on cuts to direct services until a full evaluation has been carried out.
The core of our message is that we're asking the government to not proceed with these cuts and that they reevaluate and then come back with a game plan.
Quebec Health Minister Christian Dubé acknowledged that cutting $1.5 billion could impact services, but that efforts will be made to minimize it. What I've asked all the managers to do is to say that we're facing budget issues and some establishments have exceeded their budgets, so be good managers. What I'm asking of the FMSQ, I just want to be clear, it's not up to them to manage the network. They have to be there for the patients and they have to sit down. I don't want patients to be held hostage during negotiations. The FMSQ is also demanding a complete, rigorous analysis of each budget reduction to assess its impacts on the quality and access to care and clear communication with the population.
It's important for us to have a clear plan with the minister. Let's stop considering health as a budget measure. Health is something else.
So far, we've not heard any clear plan from them. So we're hoping that they're going to be able to explain how they're going to go through that difficult period with those budgetary cuts.
The doctors can say whatever they want, but if patients die on the waiting lists, the patients are going to tell the minister, this is not on us. Don't view us as possibilities to save money.
In Montreal, Tehosterihens Deer, City News.